Hello people, in this video we want to look at the syllabus for MBBS students under the subject Orthopedics. Orthopedics is coming under surgery. Okay, surgery will be the main topic for you. So what are the objectives? So you should be able to recognize bone injuries, dislocations, and you should know the principle of bone injuries and dislocations. You should be able to detect and manage common infections of bones and joints, congenital skeletal anomalies. You should know appropriate correction, rehabilitation. You should recognize metabolic bone disease. Okay, then etiology, pathogenesis, manifestations and diagnosis of neoplasm affecting bones. Okay, that's like any cancerous condition affecting the bones. Okay, everything is related to bones here. Neoplasms affecting bone diseases because of the metabolic process in the body, right? Like parathyroidism and all that can affect the bone, isn't it? Thyroid, parathyroid and all, calcium, all that. Then congenital skeletal anomalies. See, even vitamin deficiency, vitamin D deficiency, etc. Congenital skeletal anomalies, skeletal anomalies you should know because of any congenital malformations. Infections of bones, joints. Okay. Here are some of the skills, okay, that you need to know. Detect sprains, deliver first aid for common fractures, sprains, and you should be able to manage uncomplicated fractures of clavicle, Cole's fracture, something to do with the wrist, isn't it? Cole's fracture. Then phalanges fracture. Then you should know the technique of splinting, plaster, immobilization, okay. Common bone infections, what are those? Osteomyelitis, isn't it? That's what it's called as. Myelo is actually bone marrow. Acute osteomyelitis, secondary, chronic, GARS, osteomyelitis, Brodys, salmonella, septic arthritis, gonococcal, syphilis of joints, fungal infections, leprosy. Wow. When it comes to other infections, tuberculosis of the spine, Pott's spine, isn't it? Continuing with the skills, they expect you to have indications for sequestrectomy, amputations, corrective measures for bone deformities, you should know. The corrective measures for bone deformities. Then advice for rehabilitation for polio, cerebral palsy, amputation. Rehabilitation. That's tertiary prevention. So you should be able to integrate with all the other subjects that you have studied. Now let us move on to the course content. This is the actual syllabus, guys, for you. So look at the actual syllabus now. We are going into the details now. Traumatology, injuries to bone and joint. So you should know about fracture, the types of fractures, the healing of fractures, how they heal, the principles and management. How will you manage a fracture, the diagnosis, the methods of reduction, immobilization, complications of fractures, management of open fractures, pathological fractures, all these you should know. You can look at all the details here, isn't it? So for every bone they have kind of mentioned. So just look at all the details here. Okay. Some of these fractures will have names. Bennett fracture, then pop slab application, what all that is. So we are looking at the syllabus of what? Orthopedics. Okay. So injuries, lower extremity, dislocation of hip, femur, trochanteric fracture, calcaneum. We are not reading everything, just look at the details. Then injuries to the spine, then cord injury, traumatic paraplegia. You'll have to learn these words, paraplegia, hemiplegia, etc. Nerve injury, right? Then popliteal, lateral popliteal. Then vascular injuries, they are talking about artery injury, all the artery injuries, subfacial compression, amputations, okay. Some names here for amputations. Siamese amputation, or is it Symes? Then there's some terminology called cold orthopedics, under which they have given deformities, regional conditions. What else is there under this? Neuromuscular disorders, bone and joint tuberculosis, physical medicine, rehabilitation, and as usual biomedical waste. Okay, anyways, let's look at the deformities. Congenital deformity, acquired deformity, clubfoot, then CDM, congenital skeletal limb deficiencies. Regional conditions, the neck, you should know about torticollis, intervertebral disc prolapse, cervical, rib, shoulder, elbow, periarthritis, painful arc syndrome, tennis elbow, cubitus varus valgus. What is this? We have read this in anatomy, isn't it? This is to do with the humerus, guys. Okay, then wrist and hand, you should know wrist drop, claw hand, ganglion, Dupuytren's contracture. Do you remember reading all this in anatomy? Palmar fascia thickens, it shortens and thickens, right? Remember? So all this you have studied in this one here, Dupuytren's contracture. In anatomy you have studied all this. Cure veins, decure veins disease, trigger thumb, carpal tunnel syndrome and all, you know that, right? What is it? The pressure on what? Median nerve. So what gets median nerve is here, the yellow. Okay. Coming to spine, you should know backache examination, spondylolisthesis. Then coming to hip, clinical examination, Perthes disease. What is this? P-E-R-T-H-E. So basically some problem with the femoral head, isn't it? Perthes disease. Children? Then knee, we are talking about genu valgum, varum, recurvatum, recurrent dislocation of patella. Oh wow. Okay. Then semi-membranous bursa. Coming to the foot, plantar fasciitis, flat foot, foot drop. All this you should know. Flat foot. This should remind you of all the anatomy where you studied the arches of foot and all that, right? So flat foot is pes planus, something like this, right? Remember, we have studied all this. Pes cavus, exaggeration of the arch. Okay. Guys, what are we looking at today? Orthopedics. What are we looking at in that? The syllabus, the course content for MBBS. Now let's continue. Okay. So neuromuscular disorders. So cerebral palsy, anterior poliomyelitis, leprosy, you should know all. We are not going into details of this. Just look at the names. Infections, pyogenic osteomyelitis, Brody's abscess, you should know. Looks like very important. What is this Brody? Brody's abscess shown here. Then you can have fungal infections, syphilitic lesions, metabolic disorders like rickets, osteomalacia, that will be in adults, rickets in children, isn't it? Osteoporosis, especially after menopause, isn't it? Scurvy, vitamin C deficiency, gout, excess uric acid, isn't it? Miscellaneous, you should know Paget's disease of bone, bone cyst, medullary deformities, diseases of joints, synovial fluid has some problems, septic arthritis, rheumatoid diseases, hemophilic arthritis. Wow, hemophilic arthritis. We are almost at the end, guys. No need to worry. Bone and joint tuberculosis. Tuberculosis gets a whole complete attention. Tuberculosis of spine, POTS, paraplegia, tuberculosis of hip, knee, other joints. Then as usual, we have to cover what? Tumors. All the benign and malignant bone tumors. So what is this? Osteochondroma, enchondroma, malignant, you can have osteosarcoma, osteoclastoma, Ewing's tumor, multiple myeloma. Multiple myeloma affects what? Bone marrow, isn't it? Myelo. Then secondaries. Okay, then rehabilitation, physical medicine. Then lastly, always in all subjects, they'll put off biomedical waste. Okay. So just let's look at some of the photos of these from pathology. Wait. If you remember our pathology videos, we have already covered all these. What will affect epiphysis, what will affect metaphysis, what will affect diaphysis, which is a benign condition, which is malignant condition. So they are expecting you to know what? Osteochondroma. They are expecting you to know enchondroma. They are expecting you to know osteosarcoma, right? So osteoclastoma is here. Osteosarcoma they have marked here. As such, this osteoclastoma is giant cell tumor. Right, it is benign. When it becomes malignant, it is called malignant giant cell tumor. If you remember osteoclastoma, you have read that there will be giant cells, but actually the malignant cells are actually in the stroma. The tumor cells are here in the stroma. Okay. Giant cell tumor, remember, giant cells are so innocent. They are not the tumor cells. So osteoclastoma, giant cell tumor affects the epiphysis. Okay. This is osteoclastoma, real one, pathology slide. So remember, this is also called as giant cell tumor, and in this the giant cells are very innocent. And when it comes to osteosarcoma, it is malignant, okay. And here also you will have giant cells, and the giant cells themselves are the tumor cells. Okay, so osteosarcoma, tumor giant cells you can see. This is bone forming, that's why you will see this word osteoid. So this should be here, isn't it? Okay, then you have Ewing's tumor, multiple myeloma, secondaries. Ewing's is affecting what? Diaphysis, okay. And what about multiple myeloma? It will affect bone marrow. So if you see here, hematopoietic marrow tumors, myeloma, okay. In this video, we looked at the syllabus of orthopedics for MBBS students. Welcome to Orthopedics. Hope you enjoyed. Bye-bye.